This morning, a doctor treating pregnant women is the latest American victim of Ebola in West Africa. The World Health Organization says the number of infections could rise to 20,000 in the next 6 months. So far, 5 countries confirm Ebola cases. Don Dahler shows us why experts say they're losing the battle against the virus. Don, good morning.
Good morning. More than 5 months since the first case of Ebola was confirmed in Guinea. Health officials say this flare-up is the largest and most complex since the disease was first identified in 1976. Health officials are warning this morning is a global threat and they may have underestimated the outbreak.
The infected American missionary doctor, who has yet to be publicly identified, is a male obstetrician, but didn't work in an Ebola ward. He is said to be doing well and in good spirits while being treated in isolation, but it is too soon to tell if he'll be evacuated from Liberia. The 2 American missionaries to survive their diagnosis, Dr. Kent Brantley and Nancy Wrightbull, were treated with the experimental drug ZMapp, but the supply is gone. So the pharmaceutical company which makes the drug is getting a $25 million boost from the Department of Health and Human Services to speed up production. The Centers for Disease Control is calling this the world's first Ebola epidemic. And the head of the World Health Organization, Margaret Chan, says everyone had underestimated the outbreak.
The outbreak will get worse before it gets better.
Ebola has been a test of already fragile healthcare systems in some of the world's poorest countries. Authorities have choked off entire towns by erecting quarantine zones, trying to stop the virus. Calling the effort so far too little, too late, Doctors Without Borders says West Africa is simply overwhelmed by the disease.
We have been losing for the past 6 months. We must win over the next 3, and we can.
Here in the U.S., there are concerns as thousands of foreign students and workers arrive on campuses at colleges and universities across the country. The CDC is asking schools to screen anyone who has been in the affected African countries in the past 21 days to voluntarily take their temperature twice a day. The countries where the outbreak is most severe send fewer than 400 students to study in America.
Wow, an interesting warning. Don, thank you so much. Sure.